Do you want to know the secret to the true and lasting success? Do you want to move from nothingness to greatness? Then Great Mind is a must-watch program for you.
People see people making quick money fraudulently, and they're celebrating the quick money. The negative values are celebrated.
Great Mind on NTA Osogbo is packaged with entertainment and educative segments, coupled with health tips to show you how to take care of yourself to look younger and make an indelible mark on the sand of time. Join Bola Olayode on the program every Saturday at 9 in the morning. Stay with us. This is the day that the Lord has made. It is a wonderful Saturday morning. You are welcome to the first edition of the Great Mind program in this dispensation. I am Bola Olayode. The personality we are discussing on this first episode of the program in this dispensation is Chief Agbola Odeyemi, the Obashewo of Ife land. He is a man of international repute. He was the former chairman of EcoBank. Meanwhile, on the air segment of the program, this sponsored by Osun Health Insurance Agency, we are discussing high blood pressure. Dr. Samuel Adeniyi Okene, the Executive Secretary of Osun Health Insurance Agency, is on ground to tell you the cause of the disease, and he also provides solutions to the problem. Come along.
Part of Osun Health Insurance Scheme's benefit package, we have what we call health education for prevention of some conditions that are preventable, particularly the chronic diseases. Those chronic diseases are those that once you have them, you must continue to use drugs to manage them because they don't have a particular cure, and that will include hypertension, it will include diabetes. Those two are actually chronic conditions. And of course we have chronic obstructive pulmonary disease, people that have asthma, people that have chronic bronchitis. All of these ones, they are chronic because they are there for a very long time, and most of the time they are not amenable because there are some of them originate, particularly for bronchial asthma. It's something that runs in the gene of the family. So all of those things, when we give health education, it is towards preventing complications arising from those conditions that are already been established, or that they are going to be established in your body based on the history that you have in your family. So we do health education as part of the health insurance scheme benefit package. And concerning hypertension, we know that hypertension, like I say, is a chronic disorder. We call them non-communicable disease, and then it's got a link with there's a familial disposition. If your father or your mother has it, there's a very high possibility that you are also going to have it. So, and for hypertension, we know that if you know your family history, then you begin to take some precautions. One of those precautions will be ensuring that you do not consume excessive salt. You take very low salt diet. You avoid junk foods. All of these fast foods that you go to get in the sector, the fast food joints, all colored and full of all kinds of, garnishings and all kinds of seasonings. All of these seasonings are actually salty. And so by the time you already know that you have a family history, you have a predisposition, you will make sure that you do not go in those areas. You modify your lifestyle, particularly in what you eat. And then we would advise you also to avoid alcohol, to avoid smoking cigarettes, or not just smoking cigarettes, but the use of tobacco. Because when you use tobacco, whether by chewing or by snuffing or by smoking, any of those are harmful factors that are detrimental to your health, and they aid the development of hypertension. So we tell the people, take low salt diet, avoid such things like use of tobacco, don't smoke, don't snuff, and then don't eat tobacco. And then we tell them, don't take alcohol. As much as possible we can abstain from alcohol. And then we tell them, engage in physical exercise. These are all preventive measures. They prevent the onset of hypertension, and in cases where the hypertension has already been established, they also prevent the development of complications from this. So we advise lifestyle modifications, including physical exercising. You avoid the sedentary lifestyle kind of thing, and then you make sure that you select the kinds of things that you eat, including avoiding to take fatty foods that are very rich in cholesterol. Red meat, particularly for people that are above the age of 50, is not so advisable. We would prefer that they take more of fish, more of white meat, more of chicken and things, and of course some of bush meat. These ones have less cholesterol content than the red meat that you get from cow meat and all of that. So these are some of the things that we do also as part of Osun Health Insurance Scheme. So we are not only just treating people, we are also involved in community health education and sensitization campaigns so that people can stay healthy.
Osun Health Insurance Agency, which has been providing access to qualitative health care free from financial hardship for the people of Osun State, was established by a bill being passed into law by Osun State Parliament under the leadership of the former Speaker Honorable Najim Salam, and also signed into law by the former governor. In demonstration of his love and unalloyed commitment to the well-being of the people of Osun State, Governor Adegboyega Oyetola, shortly after his assumption of office, in ensuring the continuity of the program, released 150 million naira take-off grant, consistent payments of 3% government share of health insurance premium for public servants. He also released 477 million naira equity grant for the provision of treatment and care for the vulnerable people in the state. The Executive Secretary of the agency, Dr. Adeniyi Samuel Ogini, speaks further.
The agitation by various state governments to be partakers of the Basic Healthcare Provision Fund, which is supposed to be money coming from the federal government to each state in order to help them to take care of the vulnerable populations, take care of the health of their vulnerable populations. Now, this Basic Healthcare Provision Fund was established in Section 11 of the National Health Act 2014. That National Health Act 2014 at Section 11 made the provision that 2% of the at least 2% of the consolidated revenue of the federal government shall be used for Basic Healthcare Provision Fund to strengthen primary healthcare system in the country, and also to provide treatment or access to medical services to the vulnerable population through the state social health insurance agencies. So any state that does not have a social health insurance agency cannot benefit from the Basic Healthcare Provision Fund. So it became a necessity for the government of the state to establish or to start the process for establishing the Social Health Insurance Agency. That was how it started. And the executive bill was received by the House. The House processed the executive bill, and I was appointed even before the passage of the law. After the bill had already gone to the House, I was appointed the executive secretary, the pioneer executive secretary of the agency that was just to start. It was myself and my letter that was the origin of the agency. So they gave me a letter that I should go and pioneer the establishment of this agency. And to the glory of God, the law that, the bill was passed into law on the 30th of October 2018. I was appointed in February 2018. The bill went to the House, earlier than that, and then the law was passed on the 30th of October 2018, and it was assented to by the then governor on the 20th of November 2018. the current Governor Adegboyega Oyetola took over the issue of midwifing the establishment of the agency. So the operational aspect, the releases that were necessary for this agency to be fully established, all of the circulars that were needed, and the take-off grant and the equity grant, all were done by Mr. Adegboyega Oyetola upon his taking over as the governor of the state on the 27th of November 2018. And since then, we have had the blessings of working with some development partners, and the governor himself has been so proactive to every of our need that within 1 year of our operations, we had overtaken even those people who have been in the system for 2 years before us, 3 years before us. We had overtaken them because the governor will ask, what is the next thing for us to do to ensure that this agency is well established to operate our social health insurance scheme, which is OAS. And I will tell His Excellency, this is what we need, this is what we need. And His Excellency will go ahead and do all the needful. Today, to the glory of God, Osun Health Insurance Agency, operating Osun Health Insurance Scheme, is a leading light among state social health insurance agencies in this country, to the glory of God and the benefit of our people.
Honorable Adeoye Adelakun is the chairman of the Osun State Health Insurance Agency.
The place has a good person to man the scheme. I'm talking about the person of the executive secretary. They went through the run of the mill and got trained as to what social insurance is, because the teaching problem that kind of a project will have is the fear of people about insurance generally. People believe generally that insurance is a scam, and they really don't get involved in it, and so that posed a lot of problem for people to get interested. Even the civil servants that are now enjoying the program were very, very loathsome to actually participate. They didn't want it. And it just has to be, you have to really convince them that the taste of the pudding is in the eating. It was after they had started enjoying the program that they are now coming. Even some of them, they are registered. They asked us to do it, and we are doing it. They didn't come around to pick up even their policy. But when the few ones that actually started, when they started enjoying the benefit package of the health insurance, that was when they now realized that after all, the program is really not a scam. And we have actually gone through a period of a teaching period, and we have been on in more than 1 year. We did a performance review, a year performance review of our activities, and the report we got is encouraging that the program has been very, very beneficial to the people of the state.
Among the objectives of Osun Health Insurance Agency is ensuring that every resident of the state has easy access to effective, quality and affordable healthcare services, and also protecting families from financial hardship of huge medical bills.
In what way have we been providing quality health care to the good people of this state without tears? The truth is that when you have a woman that is pregnant and the woman is going to deliver, he gets to the hospital, and because you didn't have money, the woman did not even attend antenatal care in a good hospital. So maybe he was attending antenatal care in some backyard mushroom clinic, and they didn't even do what they call pelvic assessment. They didn't even know whether this patient was going to be able to deliver normally. And then all of a sudden the woman falls into labor, and then the husband takes the woman to the hospital expecting to hear the good news, and then the next thing they tell him, your wife has been in labor for 12 hours now. It is going to 15 hours. In fact, even the baby is not breathing very well inside. So there is a need for us to do cesarean section. What will happen? The first thing you hear is the woman will burst into tears. She will begin to cry. The husband will run away. Some husbands will go to the toilet 5 times before they come back. And they will say, hey, baby, hey, what are we going to do? That is the tears that is associated with health services. When you have to pay out of pocket, they will tell them, go and deposit 100,000 before we can do cesarean section. That is where the problem. But with OIS, go and find out from the people. I'm sure during the course of this, you interview some of the beneficiaries of our scheme. All you need to do is carry your card. Once you carry your OIS card, you get to the hospital. They say, yes, your wife is going to deliver by cesarean section. You say, oh, very well, doctor, go ahead and do it. The maximum you are going to pay may be just 8,000 or 9,000 naira. For something that would have cost you 150, 180,000 naira, depending on the number of years that the patient has had in the past. That is the beauty of our agency. Our scheme has the slogan, we provide quality health care to the good people of this state without tears. It is quality because once you carry our card, the issue of don't go for antenatal is not, doesn't arise, because once you have our card, in fact, you will go to antenatal clinic very relaxed, because you know that everything you are going to come back with will be only 10% of the cost of drugs. And when you go for antenatal, please, they give you drug worth 1,000 naira. They tell you to go and pay 100 naira. That is all. And you do ultrasound, you have 2 ultrasound free of charge. You don't need to pay a kobo when you are registered with us as OIS. I'm just giving you an example to demonstrate the veracity of our slogan, providing access to quality health care without tears. Once you have your card, you are confident. Anytime anything comes, you just take your card to the hospital, a hospital of your choice. The hospital that you have chosen out of accredited hospital. That's the quality. It is not just any hospital. We accredit the hospitals. We go there. We do inspection of those hospitals. We know whether they have enough facilities in terms of equipment to do many of the things that needs to be done. We inspect their space. We inspect the emptiness of the environment. We want to even know the access road. Do they have a good, access road to that particular hospital? And then how many staff do they have? Do they have the medicines that's contained in our essential medicine list? That's the quality aspect of our work. So before we accredit any facility as good to provide service, we will have looked at all of those things, and then we approve that you can provide service. That's the quality aspect.
But I know a number of our enrollees.
This is Lokore's compound in Ile-Ife, the origin of Chief John Agbola Odeyemi, the Obashiwa of Ife land and Bobajiro of Iloko Ijesha. This building is the house of his late father, Pa Martin Awonilewu Odeyemi, his mother, late Alice Araola Odeyemi, 8 from Lodi's compound at Bedebede Street, Ile-Ife. John Agbola Odeyemi, who was born precisely April 4, 1939, started his elementary education at St. Paul's Anglican School at Yibaju, Ile-Ife, and completed it at SS Peter and Paul Catholic School, Ile-Ife. Young John Agbola Odeyemi lost his father when he was only 15 years old, and his mother, being a virtuous woman of great strength, devoted her entire being to her son and ensured that he grew up to be a successful man, making great impacts on her.
Again, by stroke of fortune, we were the last set of people to read Standard 6 in 1954. The free primary, universal primary education of Bafemi Awolowo was to start January 1955. And they were so ingenious, the planners. Because they went to send several hundreds of children to school. No teacher, no classrooms, but they rushed the classrooms in all sorts of corners of villages, did as much as they could, and asked to get teachers. Everybody in teacher training college, some in secondary schools, and people in primary schools were equally recruited to go and teach so that we can start the program. So I was one of those that were lucky to be selected to teach in my own school, and that's SS Peter and Paul.
Having completed his elementary education, young John Adbola Odeyemi proceeded to St. Louis College at Abeokuta, the school which was then used as teachers' training school. He was in St. Louis College at Abeokuta for his teacher's grade 2 certificate between 1956 and 1959.
Reverend Fathers who were very, very dedicated to education, welfare, and mentoring of young people. They allowed as many of us as possible to teach. I was an altar boy, I was in the choir. Some of us were useful in extra church activities, footballers and the rest of them were encouraged. And they launched a scheme to save some of our money for us so that we could go for higher education. I benefited from that. At that time, when the universal primary education started in January 55, the pupil teacher was paid £4, 6 and 8 per month, which translated to £52 per annum. And I was with the agreement of my mother and the Reverend Fathers. I was only to spend £1 a month. I was to save £3, 6 and 8 because my mother was going to feed me, and asked the Reverend Fathers to save the rest of my money for my teacher training education. We did that, but towards the end of the year, I had already passed entrance examination to go to a 4-year teacher training college, St. Louis College, Abeokuta. And Abafemi Awolowo had increased the pupil teacher's money from £52 per annum to £60 per annum. So I got an arrears of £8 to add to my savings. So I ended up saving £48 out of £60 in 1955. And my industrial, very, very industrious mother took over and said, now having saved this, having passed the exam, I will add the rest. And so we went to the 4-year teacher training college, left in 59, passed very well, and started teaching at Oyo, Alafin, at the secondary modern school.
Having worked as a pupil teacher for some time, because of his unquenchable thirst for knowledge, he left his father's land, Nigeria, for the United Kingdom to take up a career in accounting.
In addition to my grade 2 teacher's course, I already had 5 O-levels, all courses that could help me sit university entrance or do my A-level. And so I carried on that way, moved to Ife 62-63 and did my A-levels again through extramural classes. And by 63 October, I had already taught almost 4 years, plus 1 year before I went to teacher training college. I taught about 5 years before I decided to move abroad to do my professional education in accountancy. So I was in the UK between 63 October and end of November 69.
Because of his love for his mother, who has been the bedrock of his success, and the love for his country, Nigeria, without minding the civil war that was still on in 1969 in Nigeria, as he was making waves in his accounting profession in UK. He forsook everything and came back to Nigeria to contribute his own quota in building his beloved nation.
When I was trying to come back to Nigeria in 69, they were trying to find me a job as chief accountant of the group. But I said, I'm coming to Nigeria. And then the MD called me and said, study me, now this is now discrimination in reverse. I said, how can it be? He said, going back to a country at work in 69? You've been in this country for about 6 years, you have the best of qualifications, best of experiences, you understand us, we understand you, we want to lift you up. You say you are going back to that country. You say you are now discriminating against a system that made you. You want to go back to your poor country. I say yes, poor country, that's where I'm going. But my people will remain poor forever until people like me who have Western education go back home to reposition the country for development.
Chief John Agbola Odeyemi is an happy family man, although he planned to have only one wife with 3 children. Being destined to have a large family, against his plan, he ended up to be a polygamist with 3 wives. With hard work, diligence, and perseverance, you and I can attain greatness in life with the backing of the Supreme Being. On that note, we are ending this week's edition of the program, The Great Mind. Next Saturday morning is another date. Till then, stay blessed.